before we get started, I just need to go through a list of questions which we have to go through every single year. They should probably be fairly familiar. First off, how has your health been? Do you have any specific concerns today? Okay. So to follow up then, how have you been sleeping? Okay. Any kind of hot flashes waking you up or changes in temperature? Okay. Are you just having a difficult time falling asleep or staying asleep? Okay. Any anxiety, any depression, or other mood swings? Some. Okay, at night. Any skin or scalp sensitivity? Yeah, that can be related. Scalp? Okay. How about any tendon pain? When was the date of your last menstrual period? Okay. And have there been any changes? Have they been pretty normal? Still same amount of time in between, or has that changed? Okay. And are they heavier or lighter than normal? Or what's normal for you? Let's see. Are you using any kind of birth control or other contraception? Contraception. I don't know why my brain added an M to that. Okay. Okay. Any symptoms of a possible STI? And any changes to your medications, any new supplements or anything? Okay. Well, that concludes all of my questions, at least for right now. So I guess we will go ahead and get on with it. We will be needing to do a pelvic exam today. It looks like it's been a couple of years since your last one. And don't worry, you have full control there, okay? If at any point anything is too intense, if it's painful, if you need to take a break or stop altogether, just let me know. But I do encourage everyone to try and at least let me obtain some samples. It's very important in terms of keeping you healthy, and if there's a chance that we're able to detect anything early, we have a better chance at resolving that issue, okay? Okay. We're not there yet though, so try to relax right now and stay present, and I'll tell you when it's time to have anxiety. Joking. Okay. So I'm just gonna take a look at you here. For any kind of changes in symmetry or posture. Sometimes we can have issues with our joints or muscles and not be completely aware that our bodies are kind of shifting to compensate. But I'm not seeing anything concerning. You okay with me touching you? Okay, thanks. That's where the scalp tenderness is? Okay, thanks. Sorry. Just gonna stand up. I'm not seeing any kind of breakage in the skin of the scalp. No redness or flaking or scaling. No thinning of the hair either. Just feeling for any sinus inflammation. Can I have you swallow for me? Okay, tend again. One more time. Good. Okay. So, keep your eyes open for me, okay? Follow my light. And just do your best to keep your eyes open. Just gonna hold this off to the peripheral. If I can have you just close your eyes for just a moment, I'm just gonna take a look at your eyelid. Yep. And your lash line. Okay. You can open. eyes are looking good. Okay. Let's take a look at your ears, okay? I'm gonna start by looking externally. Is this okay? Is there any discomfort? Okay. Well, your ears look good, or at least this ear looks good. Not seeing any kind of redness or irritation. Your tympanic membrane is intact. There's no perforation. No evidence of any kind of fluid. Okay. Yeah, take a look at this side now. Now I'm going to look internally on this side. Any tenderness or discomfort on this side? Okay. This ear looks good too. Not seeing any irritation or redness here either. Little bit of cerumen, but that's okay. And tympanic membrane on this side looks good too. I'm gonna switch out my covers for a new one, so I could take a peek inside of your nose, okay? And alright, other side. Good. Take a look at your throat. So this is just going to go right inside your mouth and press down on your tongue. Yes. Okay, throat looks good. Not seeing any kind of redness or tonsillar swelling. I'm going to remove my tongue depressor. Just need you to keep your mouth open for me. Buccal mucosa looks good. Can I have you lift up your tongue? Thank you. Alright. You may close your mouth. So now I'm going to listen to your chest and your back, and then I'm going to have you lie back. Okay, can I have you take a deep breath in and out? Okay, and again. Again. One more time. Another deep breath for me. Okay. And other side. Chest and lungs sound good. Have you had any kind of issues with breathing due to the wildfire smoke? Okay. You have an air purifier. That's good. Okay. So in just a moment, I'm going to lie you back. And I'll put you at ease a little bit. I'm going to start just with a regular abdominal exam. So I'm just going to be listening and palpating the organs in your abdomen. Okay? And then we will move on to the pelvic. And I know this is the part that makes people very nervous, even when they've had tons of them. So there's no people pleasing allowed here, okay? If something hurts, I want you to tell me. If it gets overwhelming, I want you to tell me you're triggering it all. We can take a break. We can stop altogether. And like I said, I do encourage you to try and get through the pap smear, just so that way we can rule out things like cervical cancer, which is really, if we can get early detection, it's really good. But if that's not something that feels right today, I'm not going to force anything, okay? Okay. So I'd also like to do a breast exam today, if that's okay with you. Okay. Have you done any kind of self-checking at home? That's okay. A lot of people get anxiety doing it themselves, so it's totally okay. That being said, again, if there's any kind of areas of discomfort, if you need me to stop, or if it's triggering anything for you, let me know. Okay. I always want to encourage people to advocate for themselves. It's really important, because genuinely, if there's anything causing you pain or discomfort or anything negative, I want to be aware of it. Okay? Okay. So I'm going to adjust the exam table. Okay. Are you okay?
going to start by listening to your tummy. Sounds good. Any tenderness or discomfort? Okay. Okay. Everything sounds and feels okay there. So now if it's okay, I would like to conduct a breast exam with you. Are you okay with that? Okay. So I do need to adjust your gown just a bit. Okay. So you're going to feel my fingers, okay? And I'm just going to be very lightly pressing. Is that okay? Okay. And you're going to feel me going up into your underarm area. I apologize if this is tickly. So again, just lightly pressing around. And going under your arm. Everything feels okay there. So. How are you feeling? A little nervous? That's okay. So like I said, if anything doesn't feel right, if there's anything that causes pain, I want you to let me know, okay? And if you need to take a break at all or just stop, same deal. Are you okay with us proceeding? Okay. So to start, I'm just going to take a visual exam, okay? And I'm just looking for any kind of lesions, any bumps or drainage that would be considered abnormal. Okay, that all looks okay. And then next I want to feel your uterus. And to do this, I will have to do part of the exam internally. Is that okay? Okay. So I will be using some lubricating jelly. And I actually need to stand up for this. So. Okay, I'm going to feel my finger. Good. Okay. Just need to press. Doing okay?
feeling some potential enlargement. Do you have a history of endometriosis? I think it would be a good idea to get an updated ultrasound on you. You did great there. I know it's not a fan favorite. Alright. Just going to move that a bit. So in this packet are some instruments that I'm going to be using to obtain some samples, okay, of your tissue. And then we'll send it to our lab to have them analyze it. Usually we'll get a preliminary back in a couple of days, but it can take about a week to get a full report. And I'm going to do what I can to be as gentle as possible. There will be points where you will feel some pressure, and that is completely normal. If that pressure turns to pain, I want you to let me know right away, okay? Okay. So, are you okay with me proceeding to the next part? Okay. All right. So again, you're going to feel my hand just kind of on your thigh here, so I can position things. And you're going to feel some plastic. You okay there? Okay. Okay. So here comes that first bit of pressure. Still doing okay? Good, okay. Okay. I'm gonna put this tissue box right over here, okay? So you can go ahead and clean up if you feel like you need to. Yeah, and then you can sit back up. Alright, so now I'm going to write you some orders here, okay? So, the first is going to be for that ultrasound. Just because I did feel a little bit of uterine enlargement, and I just want to rule out any possible conditions that might lead to that. So I'm gonna start there. It could just be regular hormonal changes. It's hard to know, so I want to try and get some kind of picture of what's going on, and that way we can act accordingly. And then we're going to get you some lab work here. Do a Chem 7, CBC, reactive protein. And we'll do a lipid panel, hemoglobin A1C. Okay. And then, have you had a mammogram in the last couple of years? Okay. Yes, you are due. I'm sorry. I know it's nobody's favorite. I almost think that's worse in some ways than the pelvic exam. Just in terms of it being kind of awkward. So, okay. Yes, it is very important to do. Okay. Well, you did great today. I know it's nerve-wracking and uncomfortable, but you did it. And that's really great. That's really helpful too. I always applaud people for taking control and going through these tests. It really helps and rule out some potential issues down the line that will definitely have a better outcome if we catch them early. So, good job. Genuinely, good job. So then, did you have any medications that you needed refilled today? Yeah, let me know which ones. Okay. I will give this to my medical assistant to call in for you, and we're still using the CVS on Main. Okay. We'll get that called in. So, do you have any concerns or questions that I haven't addressed today? Okay. That's okay. If you happen to think of anything after you leave, please feel free to give me a call. Yes, the labs you can do right after this. I don't think they're too busy today. I haven't seen a line of patients or anything. The ultrasound and the mammogram, there will be people calling you from the scheduling desk to schedule both of those. I'm going to send over the orders, and you should hear from scheduling within the next 48 hours. If you don't, then you can go ahead and give them a call. They will have your information. Sometimes there's a little bit of a backup, but usually it's pretty prompt. Okay. Well, it was good to see you, and I will give you a call when we start getting results in, okay? Okay. Take your time getting your stuff ready.